we need to figure out why you have a septal perforation. So the most common reason to have a hole in the nose is actually previous nasal surgery. Statistically, that's what's caused it. Sometimes it's a septoplasty, sometimes it's a rhinoplasty, or sinus surgery. Sometimes it's cautery for a nosebleed inside the septum. That is by far the most common reason for a septal perforation or a hole in the nose. Hey guys, it's Dr. Samir Undavia from NJENT and facial plastic surgery. And this is a question that we get asked a ton. It pops up in our inbox all the time on social media and email. And it's, help, I just was told I have a hole in my nose. And there aren't that many people that know what to do about it. So they're panicking and they're searching on Google. And I just wanted to walk through what that means and then what we do about it. So first thing is that you've been told that you have a hole in your nose. Who told you? Usually it's a primary care doctor. Sometimes patients are looking in the mirror and they see that the light goes through from one side to the other. Sometimes they're just horsing around. They have a nosebleed and then they look inside in the mirror and up their nose. But somebody told you that you have a hole in your nose. So who should you see? Probably the first step is to see an ear, nose, and throat doctor or an otolaryngologist, head and neck surgeon. If you have access to a facial plastic surgeon, that's even better. But at the very least, an ENT. And this person can look with their camera and look inside their nose and see what's happening on the inside of that septum. A hole in the nose is really a hole in the septum. And a septum is the dividing wall between the left and right side of the nose. And it's meant to be straight and it's meant to create laminar flow all the way back towards the back of the nose and down into the airway, into your lungs. And if there is a hole there, it can give you a ton of symptoms. It can give you whistling, crusting, nosebleeds. It can give you some pain. It can give you trouble breathing through your nose. It can give you infections. So some people are told that they have the hole in their nose out of the blue. Some people knew that something was wrong, and then they're told that they have a hole in their nose. So first thing is to see an ENT and to characterize the septal perforation. You kind of want to get a sense of where in the septum the hole is, how big it is, the shape of it, what's happening around the hole, what's happening around in the rest of the nose. Is the septum deviated? Are the turbinates swollen? Are there polyps? So we want to know all about what's happening on the inside of the nose. Once we do that, we need to figure out why you have a septal perforation. So the most common reason to have a hole in the nose is actually previous nasal surgery. Statistically, that's what's caused it. Sometimes it's a septoplasty, sometimes it's a rhinoplasty, or sinus surgery. Sometimes it's cautery for a nosebleed inside the septum. That is by far the most common reason for a septal perforation or a hole in the nose. The next common reason is drug use. So cocaine is a big offender. It is the world's most powerful vasoconstrictor. So it clamps down blood vessels and it numbs up the nose. And so when you cut off blood supply, that area of the septum then dies and then you end up with a little hole there. So that's another common reason. But there's other drugs that can also cause it. Long-term Flonase use. And again, Flonase is a very safe medication. But if you're holding the applicator wrong and you're hitting your septum, or you keep using Flonase even when your nose starts to bleed a little bit, it can cause a septal perforation. Trauma can cause it also. If you got hit in the nose and then you have a little fluid collection inside the septum, that can lead to a hole in the nose. Things like Afrin. Afrin is a nasal spray that's a nice decongestant, but if you use it for too long, it can also decrease blood supply and then give you a hole in the nose. Some people have had packing in their nose for many reasons. Nosebleeds, previous surgery, and that pressure can also give you a hole in the nose. But once you find out the reason, that can then guide you in your treatment for it. So we've figured out that you have this hole. We have found the reason. If there's not good history for why this happened, then we need to do some additional diagnostic work. So there's two other things that we can do. We can order some lab work, we're looking for evidence of inflammation and connective tissue diseases or infection. And then we can also order imaging like a CAT scan. And that can tell us, is there anything going else in the anything else going on in the sinuses or in the rest of the nose? And it can also help to characterize the size and shape of that septum and the hole within it. So once we do find out a reason, and hopefully we will have a reason, then we need to figure out what to do about it. And so there's so many things we can do about it. It depends on the size, the shape, your symptoms, your functional status as a person. So sometimes we do nothing about it. Sometimes we just recommend hydration. Probably everybody actually gets hydration, and it's not just water in your nose, it's salt water, and it's at a specific concentration. If you put just plain water in your nose, you're actually going to feel worse. But using a saline inside your nose can be very helpful. Number one, it prevents a lot of the crusting, it washes out infection, but it can be very soothing, and it can help you breathe better through your nose. So saline, almost everybody gets. Some people also use a little Vaseline, or if we have to use a little topical antibiotic for a short time, put something with an ointment inside your nose. And it can be very helpful to also coat that hole and make it much more, soothing and allow your nose to function a little bit better. It can prevent nosebleeds. If there is an underlying infection, it can help kind of control that. Sometimes, and I'm not a big fan of this, but we can use septal buttons. If somebody doesn't really have good functional status to undergo other procedures and stuff, we can use a button. And a button is literally a physical barrier between the left and the right side of the nose. And so if you have a hole, you put a little like plastic sheet inside between that hole, and it stays there, and it can prevent the two sides from communicating. And that can, number one, help you breathe better. It can help to prevent nosebleeds. But one of the reasons I don't like it is uncomfortable, and it can give you more crusting. And you do have to change them in and out. And so it's not comfortable to have that changed in and out. Some patients can tolerate it in the office, but otherwise we have to go into the OR for that quick procedure just to put that button in. But if we choose the button, we don't burn any bridges for doing other stuff. But my choice, if possible, is to fix the hole. So sometimes we can do surgery to fix a hole, and it kind of also depends on the size, the shape, the symptoms, and the reason for the septal perforation. But once we've decided to close a hole, we can do a surgery to kind of slide mucosal grafts up and down inside the nose, as well as put a little graft in between the septal flaps and close a hole. So we have lots of options for helping to treat a hole if you do find one. Typically, the person that fixes the hole is a facial plastic surgeon, and not all facial plastic surgeons have experience in fixing septal perforations. So we have patients from all over the world come in and have their septal perforations evaluated. Most of the times we fix them, but not everybody, just because it's not the right thing to do. But we're happy to help. If you have any questions about your nose, give us a call, 609-710-NOSE, or email us at info@njent.com.